the PEDS Online Brief Guide includes how-to information, guidance about the various results, and a helpful list of referral resources and professional development information. It includes a list of online parenting resources such as kidshealth.com, which we use a great deal because we can create information handouts on common issues like toilet training, sleeping, eating, behavior, language development. And we always share a link to this site with parents so they can look up additional information that they need and get it when they need it. Our patients are more than 70% Medicaid, but we found that almost all have or can find computer access. For example, through their children's schools, public libraries, but most commonly through their teenagers' iPhones. So, how did we implement this in our clinic? And let me point out that we were in the midst of trying to go paperless and adopt an electronic record. So let me assure you, there was a little bit of grousing at the beginning, but we set aside lunch discussions 1 to 2 times a week to let our clerical and nursing staff consider what would work best. We started the sessions with a pep talk from one doc who was especially enthusiastic about early detection and intervention. And together, the team figured out what worked best. And on the next page are a few options that we use given the varying equipment across our clinics. Naturally, everyone wanted the results of PEDS Online to just automatically appear in our electronic record. And the PEDS Online team was able to do this, but we soon realized we didn't have the information technology staff / programmers or the dollars on our end to handle that. But it was easy enough to get them to add just a field box, and our software consultant could do that easily, and then we had a place where we could insert the information from PEDS Online. But I must say, we did have to pester our software consultant a bit. Across all our clinics, we always send parents home with an appointment card with the address of our clinic's website, and there we put a link to the parent portal for PEDS Online. We encourage all parents to go to the site and complete the measures before their next well visit. They don't see the results, but rather each clinic receives an email alerting them that a screen is completed. Staff then open the administration panel and paste the results into the electronic record. And all that happens before the provider ever sees the patient. We've been surprised at how many parents, even in our Medicaid clinics, do have internet access, and how much they like the opportunity to have a developmental as well as a healthcare checkup. And frankly, our parents report that their kids are teaching them how to use a computer. Now, we still have to have a plan B. Some parents don't get their screens completed before the visit via the portal. So our backup plan is that when the family checks in, the receptionist checks the PEDS Online administration panel to see if there is a completed screen. If not, she makes a note in the record and alerts our med tech. If the family speaks English or Spanish, our med tech, after gathering vitals, opens the PEDS Online site and administers PEDS and or the PEDS DM by interview. For families speaking other languages, the med tech makes a note in the chart, including that the family is about to enter the exam room. This alerts the clinician, who can review the chart and therefore decide whether to contact the translation service. We have provided our translation service with copies of PEDS. In particular, these come with PEDS Online and in about 18 different languages. These translations are far superior than letting translators just kind of come up with their own translation. So our providers in most cases walk into the exam room with their laptop, and at the end of the appointment they print out the parent summary and any parenting handouts for the families to pick up. And even if the family doesn't speak English, we send them home with a summary report from PEDS Online and any needed parenting information handouts. We found that families who are not speaking English or Spanish will inevitably find someone to help them understand the content. Now, another problem that we had is because our printer in our office is near our busy receptionist desks that sometimes they are too busy to notice that there are handouts waiting. So we created some pre-printed sticky notes that we put on the billing sheet that remind them that there are printouts waiting for the family, and this has helped enormously at getting families the information that the clinicians wanted them to have. We also had to do a little computer training with our providers, and so we created another pad of sticky notes that we just have pasted on everyone's laptop or computer, and this really helps to show them how to switch back and forth between PEDS Online and the electronic record, and how to copy and paste, but it's clearly just a few simple steps. So to summarize, it took a while to figure out how to make PEDS Online work in our very differing clinics. Help from our office staff was crucial. Staff and clinicians appreciated the time our physician champions spent explaining the value of early detection, and together we all worked out a workable process. We've also discovered that we're better able to earn dollars for the work that we do. We save time, we have shorter visits, but they're more focused and productive. Our clinicians are more confident in the decisions they make due to the evidence-based support of quality and accurate screening tools. And we are far better able to collaborate with referral resources, get parents to follow through, and get feedback on outcomes. And having looked at parent satisfaction, our families love being asked about their concerns. They learn to notice and pay attention to their child's development and behavior more carefully. They are more likely to come back for well visits, and they rarely raise disruptive and time-consuming doorknob concerns. They are far more likely to follow through with our developmental promotion suggestions and our referral recommendations. So, you probably have some questions, and let me anticipate some of those. The first one is, how long does all this take? Well, PEDS and the PEDS DM each take about 2 minutes if we have to interview families. The MChat takes about 3 to 5 minutes, but generally we often send families home with a copy if time is lacking. We've gotten most of our families, about 75 to 80%, to use the PEDS Online Parent Portal, so they're completing the questions on their own time. And that just requires us to review the results, and the review takes about 30 seconds. Another question is probably, how much does it cost? Well, the cost is between $2 to about $2.25 for any or all screens administered to a child within a 30-day period, and the price range is based on volume. So next up, you want to know, do we make money on this? Is it costing us? First of all, we had to learn lots about how to bill and code optimally for reimbursement. On average, we receive about $10 per screen, and this more than outweighs the cost of using PEDS Online, which, as we mentioned earlier, also returns helpful billing and coding information. So for the $2 to $2.25 that PEDS Online costs us, we may be billing $30 and generally are getting that with careful billing and coding procedures. So here you can see a bit of this. I must say that coding procedures vary from state to state and from payer to payer. So ideally, the clinic coordinator spends a little time trying to figure out the optimal approach for each payer. The other thing that we do is appeal all denied claims. So never take the first no for an answer from any payer. And if our appeal doesn't work, we send a note to the American Academy of Pediatrics via their coding resources hotline. The AAP is actively working on this issue to make sure that we get paid for the valuable work we do. So maybe the last question is, so how do I look at this for myself? And so here is the link, and you can go to pedstest.com online, and you can take a trial on 30 families and see what you think. So thank you very much. Bye.